My name is Barbara and you're tuning in to the Malacca Manipal Medical College webinar series for specialization. Today we would be focusing on the dentist road to specialization, covering the fields of orthodontics as well as oral and maxillofacial surgery. Before we begin, we would like to invite all viewers to mute your microphones, and if you would like to ask questions, to please use the chat box feature. Our facilitators will be on standby to take your questions at the end of the session. We have on our panel today Professor Dato Dr. Rusdi Abdul Rahman, who is a professor in our Department of Oral and Maxillofacial Surgery. Joining him, we have Associate Professor Dr. Krishna Arora from the Department of Orthodontics. Good afternoon, sirs.
Good afternoon, Barbara.
Good afternoon, Dato.
Yes.
Hi, Dr. Krishna.
Good afternoon and hello to everybody.
Great of you all to join us today. I'm going to introduce you in a little bit more in depth to our viewers. We'll start with Professor Dato Dr. Rusdi, who is a graduate from the University of Tenta. He is also a member of the Royal College of Surgeons England, where he obtained his Masters of Science in Oral Surgery. Dato has held a range of roles, not just in academia, where he had taught with various institutions in Malaysia, but he's also had a successful and long practice as an oral and maxillofacial surgeon. Joining him, as mentioned earlier, we have Dr. Krishna Arora, who graduated from the Rajiv Gandhi University of Health Sciences, India, for both his BDS as well as his MDS. And he holds fellowships with the International Congress of Oral Implantologists, as well as Invisalign from AlignTech in the USA. Similarly to Dato Dr. Rusdi, Professor Dr. Krishna has also been in academia as well as a practicing dentist. So, sirs, this afternoon, we would like to hear from you a little bit more about each of your area of specialization. Orthodontics, a lot of people usually associate it with braces. So Dr. Krishna, we'll try and see if orthodontics is more than just braces. And Dato, for you, in terms of the surgery, a lot of people always think that it is trauma related. So we're going to try and see if oral and maxillofacial surgery, you are a candidate for it only if you're involved in a car crash. Okay, so why don't we start with you, Dato? Could you tell us a bit more on your area of specialization?
Okay, thank you very much, Barbara. What a superb introduction by you. All right. Okay, actually, orthodontic surgery is surgery to correct the irregularity of the jawbone. When your jawbone is not in proper alignment, okay, that will have functional effect on your biting, chewing, speaking when speech, yeah, so on and so forth. So when we do this surgery, it will sort of correct and improve the facial appearance, plus as well function when you smile, you talk, your speech, so on and so forth. So orthodontic surgery actually is surgery that we call that may be corrective option if patient have jaw problem that cannot be resolved by with orthodontic. So when this patient has problem, they must go and see orthodontist first. Right. And if the problem could be resolved, then that's it. Otherwise, if the problem need surgery, then the orthodontist will refer the patient to us. So in most cases, patients also have braces on their teeth before surgery, yeah, because they see the orthodontist first, okay, and that braces will be there during healing and when the treatment is complete, okay. When the treatment is complete, the orthodontist will remove the braces, yeah. Okay. So That's all, Barbara. I mean, that is roughly what is orthodontic surgery means.
Okay, all right. What about you, Dr. Krishna? Is that Tom Cruise before and after, sir?
Yeah, hello and good afternoon to everybody. And thank you, Ms. Barbara, for the invitation and the introduction. Let me start with the orthodontics and dentofacial orthopedics. As the name suggests, orthodontics means the straightening of the teeth, and orthopedics means the straightening of bone. So what is actually we treat when we have the patient? So when we are treating the teeth or the malalignment, we say when the patient comes with you with the problem of crooked teeth, malaligned teeth, or they have the gap in the teeth, their inability to bite or chew properly, they have overexposure of excessive gums when they smile. So these are the problems we treat when the patient has a problem with the teeth. Also, we treat the patients who have a problem with their growth with the jaws. We call as dentofacial orthodontics and orthopedics, like the correction of mild to moderate facial deformities. Like sometimes patient has a large, bigger upper or lower jaw. Sometimes they have small lower or big jaw, inability to close the lips. They have small chins or poor facial aesthetics or problem. So these are the basic problems or the patient we deal when they come to our department. Moreover, having a beautiful smile gives you overall confidence, and you are not afraid or shy of being more sociable person in the society. So this is what we mostly deal in department in orthodontics and dentofacial orthopedics. Also, the best part of my specialization is the catching of the problem, all these problems just now I've mentioned at an early age. As Prof. Rusdi mentioned about the extensive procedure available to correct the gross deformities of the jaws and face. If an orthodontist sees these patients at an early age, when the growth is still possible, we can able to correct the most of the problems without the need of braces or without going into these surgical procedures. Let's say around between 9 to 14 years of age, that's called as a growth period. If we get those patients at an early age, we can eliminate the use of braces, even the surgery. Yeah, so that's a brief about orthodontics.
Okay, so there's a lot of overlaps between your two areas, but I am curious, which department would a patient normally start their diagnosis procedure? For example, if it's a teeth gap thing, obviously, Dr. Krishna is yours. But take, for example, someone feels that their mouth is not fitting right, not all comfortable. Dato, would they go to see you first, or would they go and see Dr. Krishna first, who would then refer to you?
Okay, there is a criteria actually, and basically this is the job of a dentist. And there is a criteria to analyze and to check whether the patients actually require an orthodontic treatment or a surgical treatment or he does not require. So there is a index we call as indices, and we teach all our students to do these indices to perform. And when you are posted in your government posting also, you will need to do this. So there is a grading in that. So when you see a patient or the patient's mouth, you will see how extensive the problem is. So based on the grading, you will refer to a specialist like an orthodontist or to an oral surgeon to get and do the further checkup from the specialist.
Okay, interesting. Okay, so Dato, how did you decide on your specialty?
Oh yes, Barbara. Actually, when I was working last time, I met with so many patients who have problem with difficulty in biting, chewing, and their jaws, you see, I stated there melting bone, meaning that the teeth meet unevenly, not in proper alignment. So their biting is traumatic biting. So that will cause the bone to resorb, you see. And also, many of them have mobile teeth, and then their teeth wear faster, and sometimes they have a problem with sleep. When they sleep, there's a partial stoppage of breathing because their jaw, the lower jaw, is placed backward, more backward, you know.
Okay. So it blocks the airway.
Yes, exactly. And
Okay.
then they have also come complaining with disproportionate facial feature. Maybe, you know, our face is being divided into three portion. We call it upper face, mid face, and lower face, you see. So this feature is not
Not
proportionate.
balanced.
Yes, and this will have a bad psychological impact on the patient. So they have emotional problems, so on and so forth. They fear to see people because when you see people, the first impression is that people will look at your face, at your face. So when I saw all these patients, I feel very, very sad. I mean, I empathize with them. And because of this, I say to myself, I must go and pursue this and try to help all these patients.
Okay. Now,
All right.
like item number 6, right?
Yeah.
Disproportionate facial features. A lot of people say you're born, your face is born like that.
Yeah.
You know? So it's such a fine line for someone to say that, yeah, my face may have been born like that, but I don't like the look of it.
Yeah.
Do you have people coming to you with no other problem but just, you know, not liking the balancing of their face? Do you have patients that come to you like that, or it's normally because the disproportionation of the facial features has caused other issues like, you know, the bite, the teeth wearing and stuff like that?
Yes, Barbara. Usually when they have a disproportionate facial features, they have a problem with their occlusion. It is very related. So first and foremost, we will take proper history, and we actually wants to differentiate between this patient who have a real disproportionate facial feature and someone who is normal, just that their facial appearance is not attractive. They want to be beautiful. So that kind of patient, we actually refer them to a psychiatrist. Yes, yes. Because we fear that if we were to operate on them, they will not be satisfied. They will go and see another surgeon, then another surgeon to make their face beautiful. So actually, alternative surgery is to treat this functional problem plus that item number 6. They come together. So if we have a problem with that functional plus disproportionate facial feature, they want to improve their appearance. That's not our job. I mean, we will advise the patient, you are okay, just that your appearance is like this, and we cannot improve it. Okay, meaning that that particular patient has no facial deformity.
Right.
So if we have that patient, we won't operate on them. So actually, alternative is not to improve the beautiness of the face. No, we just do the appropriate thing. We improve function. We improve the malalignment of the jaw, and we also make the facial bone proportionate. And when we treat this and the facial appearance improve, the patient become more beautiful. Actually, it is a bonus. It is a bonus. So the main treatment is not to make the patient beautiful.
So it's not aesthetics driven, but functionality driven.
Yes, Barbara. It is not aesthetic driven. It is functional. But when we correct the functional, meaning that the occlusion is well, the patient can bite, the breathing is good, the speech is okay, and the face now is proportionate. Usually, it comes with that bonus. It makes the face looks more, the appearance more beautiful.
Yeah.
Okay? All right.
Yeah. So it's a byproduct of.
Exactly. It's a byproduct, not the main aim.
Right. where else, Dr. Krishna? A lot of people wear braces because they say they don't like the way their teeth are lining up. It's affecting their smile. Would you say that was a reason why you decided to go into orthodontics, or you were driven or inspired to go into your specialty because you feel that it's more than correcting a smile?
Okay, let me tell you frankly, actually I wanted to pursue postgraduate in conservative and endodontics, not in ortho. That was my first choice. Because for a very simple reason that during my extensive training during the dentistry, I did very well in the subject, doing root canals, doing the fillings. So I was very much familiar with these procedures. Whereas compared to ortho, I have no knowledge about ortho. So actually, I wanted to pursue in conservative and conservative and endodontics, and not orthodontics.
Okay.
So orthodontics was my second choice, and it was still under my consideration due to very interesting reasons. The first reason being, it was the only branch of dentistry which I have no clue about braces. We have been taught only about removable appliances and not the fixed appliances. Means we don't know anything about braces.
Okay.
And it was the only branch where I don't know what I have, learned after 5 years of studies, because usually orthodontics is considered as a postgraduate subject, as similar to the surgery, where you have to see your patients for a longer period of duration, then only you will able to learn. So
Okay.
that is the one reason. Second reason, it is also a branch where you can see the patients, almost all age of groups. Like you have a patients coming from children who are kids, adolescents when they are in young age, and when they're adults also. So it is the only branch where I can see a lot of varieties of the patients coming in with their different type of problems. So that was still under consideration, but that was my second option because I did not know much about ortho in my dentistry. So what happened actually in India, let me tell you, if you join a specialty course or you want to become a specialist, you need to clear first the entrance exam. And based on your marks and number of the seats available in the universities, you can try your luck. So based on the marks, what I have achieved, I have been offered conservative and endodontics, which actually I was wanted before. So I have happily accepted that. But I think it's the fate that has already decided something better for me. So just a few weeks before I was about to start my college, I got to know that due to some non-compliance in the seats in the same department, the recognition has been not given to run the course in that year. So
Right.
yeah, so because of the non-compliance, all the seats has been taken by the government. So
Okay.
all the students have been told to reapply to some different universities. So, but it was quite late because most of the procedures have been finished and all the seats in the other universities has been allotted or occupied already. So after trying some hard, I got to know that there is, because of the very good performance of the previous years, one of the college got a few extra seats available, but that seats are available in orthodontics. So as I mentioned you, to get to enter into the specialist examination, you need to score high.
Yeah.
And my scores were at the par, and ortho was a cream. It was on the top branch. So to get
Okay.
into ortho, you need very good marks and the top marks. So maybe I thought I will not be able to join ortho because my marks were like few marks shorter than the conservative and
Budget. Yeah.
so, but when I went and talked to the college, they seen all the scenario and they have seen my report cards of my previous marks of the universities during the dentistry and what happened with my endo. They said, no problem, we will look into it, and they consider my application. And that's how I started my orthodontic journey.
Excellent, excellent. So, like you said, sometimes a wrong turn takes you where you were destined to go. Okay.
Yeah,
So,
exactly.
coming back, Dr. Krishna, you shared some of your journey, specialization journey, and we'll talk a bit more after this. But Dato, you did your BDS in Egypt.
Yeah.
And then you went on to do your oral surgery masters with University of London.
Yeah.
What was that like? How was that like?
Oh, it is interesting, Barbara,
Mm,
because for my bachelor, I went to Egypt, and Egypt is a beautiful country. I mean, you see, there's pyramids, the
mm-hmm.
Niles, and all
Yeah,
those antiquities. Oh,
that's right.
I love it so much. And then after 5 years over there, then I worked in the Ministry of Health for almost 10 years. And
Mhm,
after that, I got the offer to be a scholar again, to go
mhm.
to University of London to do my master, and followed by there is 2 years, yeah, Master
Right.
of Science in Oral Surgery in the University of London, and to do my fellowship in the prestigious, this is a prestigious Royal
Exactly.
College
Yeah.
of Surgeons, uh, England. This is the Royal College of Surgeons, England.
Yep.
I mean, in the UK, they have three royal colleges. One is England, the one
Yep.
that I went to. Then they have the Royal College of Surgeons, Edinburgh,
Yep.
and Royal College of Surgeons, Glasgow,
Yep.
and one more in the Republic of
Ireland.
Ireland.
Yep.
Yeah, four. So I went to this, and it was a very nice place. This Royal Colleges of Surgeons in
Mhm,
England, and I love their anatomical museum.
mhm,
Fantastic. They have
mhm.
a very rare collection of all the diseases that affect the face.
Right. Okay.
Then after doing that in London for 4 years, then I work again. Then the government sent me for alternative surgical training.
Mhm,
That was in the Royal Adelaide Dental Hospital
mhm.
in Australia, and in 2005. And then 4 years after that, I went to Beijing. And the, this is another fantastic place. I went there, and I took the opportunity to see the Great Wall,
Mhm.
the that place where the emperor stay.
That's
Oh,
right. The Forbidden City.
yes, Barbara. The problem city, fantastic. I mean, I learned from a good place. That is the Peking Institute of Stomatology, where I learned two sub-specialization. There is alternative surgery and cleft and palate,
Mhm.
because this interconnected. Yeah.
Yeah.
Then I have the opportunity to visit all those antiquities, all these uh, famous places, and I
Mhm.
really appreciate all those experience. But Barbara,
Mhm.
now the journey for our future specialists are not like this, because now they have the full course done in here
Yeah.
locally. If
At
they want
our
to
public
become the
universities.
Yes, if they want to become the oral maxillofacial surgeon, they have
Mhm.
to apply to join the University of Malaya, or
Yeah.
University Kebangsaan Malaysia, or University Science Malaysia.
Mhm. Mhm.
Only for the specialization in alternative surgery, they have to go overseas. But for the initial master,
Mhm.
uh, the 4 year masters, they have to do it locally.
But there is still the option, right? If someone is capable and have the financial means to actually apply like you did and study abroad for their masters.
Yes, Barbara. But
Because,
you have to put up with your own money.
yeah, you've got to pay
And
for it yourself.
yeah, it is damn expensive actually. Damn
Okay,
expensive.
okay,
Yeah.
all right, okay. Dr. Krishna, so you mentioned that you sort of stumbled into the field of ortho. Um, Tell us, I mean, how many years is the master's, and you also got a fellowship with a couple of companies in the US. How did that come about?
Okay, so first of all, the master's, as you know already, it's been 3 years of duration in the course. As Prof. Rusdi mentioned about his journey, it's quite long. For me, it's not that long, but yes, it was full of ups and downs. By now, you already know about getting into orthodontics, how I got the specialty. But I have joined the dentistry. The reason being because it was my dream to join a medical college or a dental college, and to become a doctor. I was very passionate since my childhood and very determined to become one of those people who actually cares for other. So that's how I was very much interested since the beginning to join a dentistry. And once I finished my dentistry, I never stopped, and I continued for pursuing my post graduation in orthodontics. And even after the orthodontics, I have few other interests, as I have mentioned, into the aesthetic dentistry, the conservative. One of my other interests was implants. So, as I mentioned in my CV, that I was associated in the private practice from quite a long time. So, I've been doing the implants and other things during my clinical practice. So, I got the opportunity to write the exam for ICOI, and
Yep.
I got the fellowship of implants as well, along with my orthodontics degree. And there is a new current trend, probably people will be aware of. We call it as Invisalign. So Invisalign
That's
is,
the realignment without the actually seeing the braces.
yeah, exactly. We sometimes my patients called as a braceless treatment. So where you don't have to wear braces, but there are now different technologies coming up whether you have to wear only the type of aligner systems.
Yeah, it's
So
like a guard, like a mouth guard kind of
Uh,
thing, right?
yeah, it's looked like a mouth guard, but it has been software and engineered by companies, so they will automatically track your, the results and how your progress is going on.
Okay.
So it was also a kind of interesting thing. So I went to learn the course, and it was quite a good show that time. And now I've been providing the Invisalign and the Invisalign course also to India, and yeah, it's quite a good thing. So apart
Yeah,
from my
yeah.
uh,
Yeah, so both of you have got, it's obvious that your BDS provides you the foundation, and like Dato, Dr. Rusdi, he did the traditional, doing a master's, a fellowship, and then surgical attachments. And Dr. Krishna, you did your BDS and then your master's, but you then decided to take what we call professional certification programs.
yeah,
So yeah, it's a very interesting scenario that we have here, because one of the things that our dean has always said is that dentistry is a field where you can specialize, but not necessarily just through the traditional method of doing a master's program. But that professional certifications like the ICOI, Invisalign, all these brings value to your career as well.
yeah, of course, our society is growing and trends are changing. So you have to keep up your pace. You better be smart in your, the
Yeah.
field you are. If you are really interested and you are passionate about it, you will definitely keep up your pace.
Yeah, excellent, excellent. Now let's talk a bit about the pros and cons of your area of specialization. Dato,
Yeah.
obviously your field is a lot more intensive. No offense, Dr. Krishna, I know yours is equally intensive as well, because it involves surgery.
Yeah,
And I would
of course.
think that every time you work on a patient, your mental awareness and state has to be like 110, 120%, because we know that where the mouth is, there's also a lot of facial nerves.
Yes. Yes,
Yeah.
Barbara.
So, are there still pros there? Because like you said, you go into extensive operations and stuff like that. But tell us the joys of being a oral and maxillofacial surgeon.
Oh yes, Barbara. Actually, the pros is seeing your patient after the surgery. Seeing your patient to be very happy and contented. Actually, it is a reward enough. You see. So I want to relate one of my patient who was a student about to go to overseas. You see.
Okay.
That student have a long face appearance, long face, meaning that the face looks very long, and that patient needs extensive surgery to the face to make the facial bone balance. Yeah.
Okay.
So the surgery was very extensive. It took, I think, I still remember, about 4 hours. It is a double jaw surgery. We did surgery on the maxilla and the mandible. So once the operation is successful, after a few months, when the patient came, the smile on the patient's face make all your tiredness before the time that you spend, the energy, so on and so forth, worth. So I'm very happy with that. So I mean, when the patient is happy, there is a reward enough. I mean, that reward is, to me, more than the amount of money that you get from your pay, so on and so forth. I mean, it is very satisfying. Okay, and then this surgery actually not only improve the function of the teeth, it bring also health benefit. Like when the patient has problem with their breathing during sleep, because the lower jaw, usually we call it in class 2. In class 2 means the upper jaw is forward and the lower jaw is much backward.
Okay.
And that causes your airways to be deficient. Okay. Your airways, the airway that goes to your lung get So when you did this operation, the patient will get a good breathing, his sleep will improve, and the chewing, and of course followed by swallowing. And this actually tremendously boosts up their confidence.
Yeah.
Okay. And also, when their facial appearance improve, automatically their what they call their moral, it is a moral booster to them. And from then on, when they see people, they're very confident, very happy, and they don't have something to, like trying to hide something.
Yeah, there's nothing to hide. Exactly.
Yes.
Yeah.
So this actually make you think that the pros is more than the cons. And the cons, if I want to tell it, actually, it's just like long training process. Like I show you my journey. The training process is very long. It takes a long time. And then the operation you do on the patient is very expensive, meaning the patient has to pay. And there is no insurance to cover this kind of operation.
Okay.
Because in our country, this kind of operation is being classified as under what do you call it? Cosmetic.
Oh, really?
So, yes, the insurance does not cover.
Doesn't cover.
Yes.
Now,
but when I was
going to ask
in the UK, again.
What if, say for example, someone was involved in a horrendous accident? It could be in a car accident where the lower face, hit the steering wheel and completely damaged. Are those then considered still as classified as cosmetic surgery, because it's a trauma, right? You had to you had to fix the face again.
Yeah. Oh, so Barbara, this is a very good question from you. Yeah. So actually, when the patient get facial deformity due to the accident, this is the only one that's being singled out by the insurance company that they will cover. The rest, actually, though they have functional problem in biting, so on and so forth, or they have that sleep apnea problem, you know, difficulty in breathing, they classify it under, very strangely, they classify it under cosmetic because this patient go and see the orthodontist first. So when you see the orthodontist, this insurance company in Malaysia, they classify it that it is cosmetic.
Cosmetics, yeah.
Yeah. But when I was in Australia and in China, over there, their insurance cover their operation because over there they have reclassified that this is not purely cosmetic. This is functional actually. So here in Malaysia, we still hold to the traditional belief that this surgery is more towards cost basis. Oh,
interesting.
That's bad actually.
It's interesting. I mean, and Dr. Krishna, I'm sure Dr. Krishna, you will agree to me. Half the time, Dr. Krishna, your patients are coming to you for braces because of aesthetics reasons and not because of function problems.
Yeah, sure. I mean, nowadays, if you see the trends, because of the lack of awareness, sometimes patients have the problems of chewing and biting, and they have pain in the joints, but they are not aware that these are the problems. So even if they have these kind of problem, they will less likely to approach you for the braces treatment. The most number of patients that comes to you, actually they have minor, complaint, like their smile is not very good, they look like a Korean, they want to look like a Korean, and they just want to enhance their smile. Yeah. So, but sometimes when we check, because there is a etiology behind all the type of malocclusion, why this malocclusion happens, so there is some etiology behind it. So probably the patient has come for you for the different chief complaint. Patient wants to enhance their smile, but back then when we check the etiology, the problem behind lies in their jaws and somewhere behind the genetics. So we don't only treat the smile, the chief complaint the patient came for, but we also do try to correct their main problems, why the problem he feel or she feel has. So,
yeah. And I think one of the pros of your field is, for if the parents are discerning and well read, and they bring their child to a pediatric dentist, and then orthodontics problems get picked up, you tend to sort of, like, similar to a pediatric dentist, you tend to work with the patient from a young age right up to adulthood as well, don't you?
Yeah, that's correct. That's why I just mentioned a few minutes ago that we deal with a lot of variety of patients when the patient is still kid, around 9 years or 10 years of age. That was actually the best age we would like to see the patients. Because if we can see the problem at an early age, we can catch the problem at an early age, we can still able to manage with the different kind of current trend, technologies, the appliances we have currently. It's very successful. So we can really avoid braces. Even braces we can avoid later on if we see the patient at an early age, because we can do the manipulation, we can do some changes in the growth of upper jaw, in the growth of the lower jaw, with the appliances, with type of headgears and other things. So definitely we would like to see the patients at an early age.
Yeah. Okay, great. Now, I on the area of similarities and differences, I have a question, right? It sounds like both specialities, it's not a really a stand-alone type of practice. For example, Dato, most of the time your both orthodontics and oral and maxillofacial surgeries, you will be doing a lot of referral work. Am I correct to say that?
You're asking me?
Either one. Either one. It's an open question.
Okay. Yes, Barbara, I totally agree with you. Actually, this work is collaborative work between the orthodontist and the oral maxillofacial surgeon. In fact, we have a joint clinic.
Okay.
In Malaysia, I once headed the Center for the Management of Dentofacial Deformity uh, in Seremban, Negeri Sembilan. So there we have this joint clinic where we have meeting with all the orthodontists and all the oral maxillofacial surgeon in Negeri Sembilan and then Melaka and Johor, where we discuss all the cases that need further management by the oral surgeon. But actually, we need the orthodontist because along the way, after we have operated on the patient, sometimes we need the orthodontist to do the minor adjustment to the occlusion, okay? And also sometimes after surgery, we need to do another little surgery just to correct the minor misadjustment. And most of the time, the orthodontist will point it out to us. They say that the bite on the left side needs to be readjusted, and maybe the chin, the position of the chin is not proper. So, Barbara, this surgery actually is a precision surgery, very precise. And we move the jawbone and the facial bone not by centimeter. We move it by millimeter. Even
Wow.
1 or 2 millimeter movement, it will give a great impact on the facial appearance and also on the occlusion. And even if the movement is not right, post-operatively, patient will have pain in their TMJ. Okay,
Yep.
so right from the start, we work closely with our orthodontists, and all this while they are very helpful. And because of this cooperation, the success of the surgery is very great indeed, very great.
Okay. And Dr. Krishna, you were telling me that, that this is something, as Dato said, the collaboration is very, very intense. Now, out of 10 patients, how many would you say you would have to refer them to a surgeon on average?
Actually, I agree with Dato, and that orthodontist and oral surgeon will always work hand to hand. And we share a very close relationship with not only an oral and maxillofacial surgeon, but also with a periodontist and a periodontist as well, because our branch involves a lot of adjustment and the referral from the gum surgeries, from the surgery, not only the jaw surgeries. Sometimes patients comes where their permanent tooth is impacted, it's still not erupted, so we need a surgeon to do a small surgery, perform a cut, and then expose the canine. Then we put the braces and try to pull the canine down. And sometimes the patient has a very constricted or small upper jaw, so we need an assistant from surgery, so we can surgically expand the upper arch. So there are many cases. It's very frequently, we work with very close relation with an oral surgeon. I remember during my post-graduation day, I had around three cases where my patients, we have done the extensive surgery because we miss the patient at an early age, and
Right.
so already the malocclusion and the deformity has already occurred in the patient. We don't have any other option but to undergo for surgery. So we have gone for bi-jaw surgeries, as Prof mentioned a few minutes ago. It's very extensive surgery. We have to do the surgery perform, and it should be very precise in including your maxilla, your upper jaw, and the lower jaw. And I was present at the time of surgery in the OT, and it was quite a long and tiring procedure. But at the end of the day, when the patient comes out, and we did the pre-surgical phase, the braces around 1 year, and then followed by surgery. And after the surgery, we followed up the case. Again, the braces patient has to wear for another year. So after the completion of the whole procedure and the whole treatment, the patient was so happy, and you cannot count those blessings and the moments into money or anything else. So
Yeah.
it's quite a good experience, and we actually come across very frequently these kind of problem.
Mm-hmm.
uh, let's say I can say around 25 to 30% of patients who comes have the jaw
Wow. Okay.
problems. But the problem is, if we want to refer them to a oral surgeon, sometimes these extensive surgeries can only be done by a specialist. If you're
That's.
not expertise in your field, it will not going to help you. So
Mm-hmm.
sometimes a patient couldn't find a specialist. I'm talking about especially in Malaysia. So
Mm.
they have a patient is unable to find a specialist, or sometimes patient is scared of the surgery. The word when we use, we have to go for surgery. The patient is sometimes very scared that patient is not willing to go for surgery. Maybe patients sometimes prefer to extract few teeth in comparison to go for surgical procedures. So I would say around 25 to 30% of the cases actually require surgery, but
Mm-hmm.
only 5% of the patients will actually go and get their surgery done.
You're talking to one who's got a partial erupted tooth and in her
Yeah.
40s and still leaving it as it is. So I completely know what you're talking about there. But
Yeah.
it's great. It's great, and before we close off, is there any words of wisdom that you would like to share with our viewers today? Let's start with Dato.
Oh yes, Barbara. First and foremost, I think dentistry is very rewarding and satisfying profession because the result of your work is quite fast. Even in orthodontic surgery, post surgery, you can see the result. The occlusion gets better, and the patient can smile better, can speak better, and if they have this sleep apnea, that will be gone by then. Okay,
Mm-hmm, mm-hmm.
it's quite fast. And also, when you become a dentist, actually, you have a very flexible lifestyle. You are being uh, your own boss. You don't have other bosses
Mm-hmm.
above you. You own that clinic and be your own boss.
Mm-hmm.
So you don't have tension, so on and so forth. And in dentistry also, I mean, we cure our patients sometimes,
Yep.
but we comfort them all the time. Actually, we don't cure all our patients' diseases. See, as an example, Barbara,
Mm-hmm.
patient with neuralgia, like trigeminal neuralgia,
Yep.
they will suffer them for the entire time of their life.
Exactly.
Okay, but when they come, we give the doses of the medication we change, and maybe sometimes we change the medication, so on and so forth. And actually, we don't cure them. We
Yeah.
just relieve them of their discomfort, the pain, so on and so forth. But actually, we comfort them all the time. We give them good support,
Yes.
empathy, so on and so forth.
Yeah.
Okay?
And
And
in fact, on that note, your field would be one of the fields where that particular disease is not you don't brush it off as a phantom pain kind of thing.
exactly, yeah,
Where else a lot of other people, a lot of other fields might say that okay, it's in your head, you
yeah,
know, that sort of
okay,
thing. But when you talk to a dentist about this, you guys know how intricate the nerves are, and how just like you said, a millimeter off anywhere can actually
yeah,
cause excruciating pain that can't be pinpointed.
yes,
So yeah,
yes,
you're right. You
right.
bring comfort, and you help them remember that they're not mad. So
Okay,
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 all right.
Barbara.
And Dr. Krishna, what about you? Any words of wisdom?
Yeah, I would like to say a few words. First thing is, I would like to say that if anyone, who are listening to this talk, who would like to join or thinking of joining medical profession, just remember the most important thing is your interest and your
Mhm.
passion. If you are really interested by listening to a talk, by now you have already known that it's not very easy to finish your dentistry. It's you have to study a lot. It's very hard working, and you have to see a lot of patients, a lot of quotas and things you have to do. So if you really have interest and passion in joining, then definitely it's a very good and rewarding profession. As Prof also mentioned, you will feel content, and you'll feel very happy and generous, the type of profession you will get into it. But only if you have the love for your profession and you're passionate, you will have a tendency that you will never give up, because sometimes you will feel you have a tendency that your tire is very difficult. Why have you joined this? So if you really have an interest, you will never ever give up your profession. So always focus on your studies, and be try to be a good professional by observing and making an accurate judgments. Second thing I want to tell, because it's a a profession which is not like a mechanism or engineering or something to
Yeah.
deal with parts. So to become a doctor, we must have to be a human being first, so that we can actually understand the problem and the pain of a patient. So then only you will be able to address those issues. So, and we know as our society is growing, the awareness of health, beauty is and all, is increasing. So the demand of aesthetic is also very high. So by treating their problems, you will actually improve their confidence level, their self-esteem, and also the overall quality of their life, which actually they don't know what was the problem lies behind their confidence, and sometimes they are very shy of smiling and going out. So you can able to help them also. This is another example of why you should join the dentistry. And apart from choosing the specialization, like after you finish your dentistry, you must be thinking that after you finish your dentistry, you must uh, you know pursue something different, and now you have chosen the dentistry or medicine. You cannot change your track. You still have an option that you can go for doing a master's in hospital administration, master's in hospital healthcare. You can do the MBA. So you don't have to worry about too much about your future if you enter in dentistry or medicine. So yeah, your future will be very secure. And
Exactly.
also, if I have to add a note, if you are confused in choosing between dentistry and medicine, which one you should choose, I will suggest you choose dentistry. You know, yeah, what's the reason?
Okay, good, good.
The reason, being is you have a lot of exposure to the latest technologies, and the clinical procedures, the extensive procedure that we are doing in a college. And also there is number of walk-in patient who comes to our college, give you a more exposure to practical. So
Yeah.
it will actually help you to learn. The more patient you see, the more patient you do, you will learn better. So yeah, it's our profession is very noble and caring. So
Yeah.
always have a feeling of giving back to the community, to the society. Yeah,
Yes.
and definitely
Yes.
you have a good scope. I
Yeah.
wish you good luck.
Thank you. Thank you, sirs. You've been tuning into the webinar from Malacca Manipal, where our Bachelor's of Dental Surgery is one of the 3 programs available. If you've completed your SPM or you're waiting for your IGCSE result, a guaranteed pathway into our Bachelor's of Dental Surgery is our Foundation and Science program. Our BDS program is a 5-year program with 1 intake a year happening in October. Very limited seats of just 75 students. And as Dr. Krishna said, we've got an on-site clinic that sees over 30,000 patients a year. Again, just to recap, your training with us in the study of your dental surgery degree would be over 5 years, where the first 4 semesters is classroom based. You do your preclinical theory work, and then semester 5 onwards, you'll be doing your clinical work. And in fact, as early as semester 7, you'll be working on patients on your own. Okay, now we come to the Q&A part, and we do have a question that's come in. One viewer is actually pursuing his MBBS right now, and is interested to know, Dato, this is for you. Is it possible for a MBBS holder to go into the field of oral maxillofacial surgery?
Okay. Actually, currently, it is the other way around. Actually, dentists, I mean, those pursuing BDS, they want to have, this medical qualification. Yes, possible. But from the medical to do orthodontic, I mean, oral maxillofacial, it is not possible because our current law forbid that. But if you go to the UK, yes, it is possible. So when you have finished your MBBS, you can enroll into dentistry, but they just, I mean, you have to, you will go straight into the third year because the first and second year is just the basic medical sciences. Yeah.
Okay, so they've got to basically, in order to go into this area of specialization that you have, they basically still need to have a BDS.
Yes, of course. Okay. Of course, you must have the BDS, but the time to achieve that, they reduce it into 3 years, not 5 years.
That's right. Okay. All right. Now, there's also another question, which is, how is oral maxillofacial surgery differentiated from plastic surgery? Or is there a very fine line between the two?
Yeah. They are different because plastic, you operated on plastic only, I think.
Whole body.
No, it's just a joke from me. Okay. Actually, as the name implies, plastic means you just operate on the soft tissue. You don't cut bone. Oral maxillofacial, the name implies oral and maxillofacial, these two field, oral and maxilla, see? It is a name of a bone. The maxilla is a name of a bone, you see? So we operate on the bone. So there are two different things. The plastic, actually, they do soft tissue surgery, but oral maxillofacial surgeon actually do mostly on the bone, but also because the bone is being covered, God made it that way. The bone is being covered by soft tissue. We also deal a little bit on the soft tissue.
But you would be then, would it be correct to then say it's more towards reconstructive?
Exactly. That is the word, Barbara. Barbara, you are superb. Barbara, you know a lot of things. I respect you, actually. I mean, superb.
That's because I have a lot of medical and dental issues, so I have to, keep myself updated so that I know when I need to go and see somebody about it. And definitely after today's talk, gentlemen, I will definitely be making an appointment to see either one or both of you to sort my mouth issues out.
Most welcome.
Most welcome, Ms. Barbara.
Yeah. So, ladies and gentlemen, we've come to the end of our webinar. We thank you very much for joining us today. We hope you found this session insightful. If you are an aspiring dentist and you're still shopping around for a dental school, we hope you consider studying with us at Malacca Manipal. We are one of Malaysia's oldest and most established private and medical and dental colleges. We've got an on-site clinic that brings in over 30,000 patients a year for major and minor procedures, which then increases your exposure and opportunities to work on patients. We are located in the multicultural city of Malacca, just 90 minutes from the capital of Kuala Lumpur, but more importantly, where the Malacca people welcome you as one of their own. And this is very, very critical because, as indicated earlier, from year 3 onwards, you'll be doing clinical work on patients, and you won't want to be studying in a location where patients do not want you to touch them. Okay, that definitely does not happen in Malacca. And as demonstrated, we've got a globally experienced faculty such as Professor Dato, Dr. Rusdi, and Associate Professor Dr. Krishna, who will be happy to assist you in preparing for your specialization and destination of choice upon your graduation. So Thank you very much once again for tuning in. Dentist gets to the root of the problem, and we hope that you've been inspired by our speakers today. This is Malacca Manipal Medical College signing off for our webinar. We'll be taking a break next week, and we will return in the month of August. Do follow us on our Facebook page, Triple MC Malaysia, Facebook page, Triple MC Malaysia, to tune in to future events. Thank you once again to our speakers and to our viewers. Have a great weekend ahead.